Welcome, everyone. Thank you so much for joining us today for a crucial COVID conversation with brilliant Black women. My name is Vanessa Bowers, and I'm the manager of the Color of Science program at COSI. We're so excited that you could join us today to hear from our extraordinary speakers while we discuss the important concerns within our community surrounding the coronavirus pandemic. Before we begin, I wanted to give a special thank you to those of you who have provided support for the program. Our lead funder, the Curtis T. and Beverly Cheeks Jewel Family Fund, and our lead sponsors, Battelle, L Brands, CAS, Honda, and KeyBank. I also want to thank our partners for the program, the King Arts Complex and the successful Heart of Protest program, MAC, the Multi-Ethnic Advocates for Cultural Competency, and Columbus Black and Alpha Kappa Psi. We're so appreciative of your partnership with COSI, and we're honored to host this important conversation for our community today. So on behalf of all of us at COSI and those impacted by the program, we thank you. Now, please welcome our first esteemed speaker of the day, the Executive Director of the King Arts Complex, Columbus's oasis for cultural and community activities, Demetrius Neely.
Thank you so much, Vanessa. I am delighted to be here today and to speak with you about this important subject. So the King Arts Complex, who are we? What is the heart of protest and why does it all matter? The King Arts Complex is located on the east side of Columbus, and our mission is we connect community through the arts. We have been doing that for 34 years. And we are proud to say that we impact about 40,000 lives each year. Even in a pandemic, we've impacted more than 20,000 lives. We have an award-winning youth education program, and we are a multidisciplinary arts organization, which simply means that we have all the genres of arts under our management. We are a resource for the community, and we are a convener. Some in the community have said things like, it's all we have left, and it's our church. So we are proud to do this work, this important work. We sit under the gaze of Reverend Dr. Martin Luther King. So the King Arts Complex, actually its name is the Martin Luther King Jr. Performing and Cultural Arts Complex, but we say the King Arts Complex for short because that's a mouthful. So sitting under the gaze of Reverend Dr. Martin Luther King is compelling to us. It means we have to speak to social justice. We have to speak to inequities. And it is sometimes mission creep, but we do it because we are compelled to do it. So the heart of protest, what is that? We convened this movement right after the killing of Mr. George Floyd. When Mr. George Floyd was killed, the world stopped. It was a difficult time for many. We cried, we mourned, we thought a lot, we talked a lot, we protested. And so the King Arts Complex, we thought, how can we actively participate in this protest? We didn't want to be passive protesters, we wanted to be active. And we came up with this idea of the heart of protest, knowing that the arts have always been at the forefront of social justice change, of reform. And so we reached out to all of our partners in the arts community in Columbus, around the state, and even across the waters, actually even in Africa, and said, hey, can you help us with this arts protest? And they all said, yes, we want to do something, we're hurting too. So we, as an arts community, have been involved in this arts protest since May of last year. And it's a movement, and there is no ending to it. We initially thought it would run May to Election Day. So Juneteenth, actually, start Juneteenth for obvious reasons, and end on Election Day because we want policy changes, right? But we realize we still have a lot to say. And so it is a movement that has no ending. And I want to publicly thank Dr. Frederick Berkeley, who said yes and has now engaged with this work with us. This is one of many things that COSI is doing around the heart of protest. So racism has been declared a health right crisis. And we have been sitting in this country as African Americans since slavery. So the heart of protest, again, speaks to the protests, our circumstances. and we're protesting the life of African Americans in America from slavery to today. Systemic racism is tied into why we have had all these health disparities. It's why we have a disproportionate impact. COVID has a disproportionate impact upon the African American community. So decades and centuries of racism, health problems, of inadequate medical attention. This is the reason that there are a lot of Black people who are saying, I don't know about this vaccination. I'm going to think about it. I'm going to wait. And the skepticism and the hesitation is real. It's legitimate. And we all know that. However, we come here today to try to dispel some of the rumors, try to, unpack it all and help us understand how we move forward with our health of our community. Today's moderator is Mrs. Tracy Maxwell Hurd. Tracy is the executive director of the Multi-Ethnic Advocates for Cultural Competency. She's also the former minority leader of the Ohio House of Representatives, where she served for 8 years. And she also has a doctorate from an honorary doctorate from Wilberforce University. Please welcome my good friend, Tracy Maxwell Hurd.
Good afternoon. Thank you, Demetrius, for your kind introduction. Really appreciate it. So excited and honored to be with all of our sponsors and partners today for this event. We are excited to get an opportunity to reenact this conversation. MAC undertook this topic as our first cultural conversation for 2021, and any opportunity to expand and share this information with new audiences, we certainly welcome that. So thank you to Dr. Bertley for the invitation. And we are so flattered to be identified as brilliant Black women. What a compliment. So we will try to live up to the charge today. Allow me to begin by introducing the two doctors who will be supporting us in getting our information today. First, we have Dr. Maishika Roberts, who is our Health Commissioner for Columbus Public Health. Dr. Roberts leads the organization and a team of nearly 500 public health professionals who are focused on neighborhood-based approaches that address the social determinants of health, from safe, affordable housing and education to jobs to violent crime, in order to decrease the health disparities that exist. I think we all know who Dr. Roberts is. If you didn't know who she was before 2020, you certainly do now, because she has been our shiroo for information in how we approach and manage through this pandemic. Also joining us today, we have the esteemed Dr. Corinne Small-Warapa. She is a passionate advocate for wellness. Dr. Wapa is a family, lifestyle, and preventative medicine physician who specializes in public health policy. She recently completed a special assignment as a consultant to the medical director and COVID response team at the Ohio Department of Health. Her latest advocacy work seeks to honor and protect the elderly and seniors living in assisted living and memory care communities. And she has been focused specifically on the African American community and helping us get information about how to manage through this pandemic as well. So thank you, both of you. Welcome to our conversation today. I am going to just kind of kick it off with just a little bit of history about kind of how we got here and why we're having this conversation, specifically around the African American community. We have a history of mistrust that is legitimate and justified just through situations and circumstances that have happened over time in the United States. Just to cite a few of the instances, we have Dr. J. Marion Sims. He's known as the father of gynecology. And historically, he performed all kinds of experimental procedures on slave women without anesthetic, trying to perfect techniques and advance gynecological medicine, which was wonderful, except being used as a guinea pig, especially without any pain management, was certainly inappropriate and cruel and inhumane. I'm sure we've all heard of the Tuskegee experiment, where they were told that they were receiving a vaccine, that they were receiving medication, and actually being injected with syphilis. So I don't know how anything could be more damaging or off-putting in terms of trust within our healthcare system. And the last one that I usually cite is Henrietta Lack. Many have become aware of her because of Oprah Winfrey's film. But her cells actually have been responsible for creating medicines that address cancer and a number of other things. They're still using them today. And unfortunately, her family received no recognition or compensation for that. So again, the African Americans' mistrust of the healthcare community is certainly justified. And that's how we come to where we are now in addressing this pandemic and the vaccine and trying to find some ways to reconcile that mistrust and our need to care for ourselves and receive the appropriate treatment. So if my doctors would please join me, we are going to begin a little Q&A here. Thank you, Dr. Roberts. Dr. Warapa, are you with me?
I'm here.
Okay. So if you would, I'm going to just allow both of you, please, to just kind of give me an opening, like 2 or 3 minutes on your perspective on this COVID pandemic and the vaccine consideration that's underway and the distribution right now. So Dr. Warapa, we'll begin with you.
Thanks, Tracy, and hi, Dr. Roberts. And Tracy, I really think in a nutshell for me, the pandemic is a great chance to step back and remind ourselves that our survival depends absolutely on the behavior and choices, not only of ourselves, but of other people. It's really a chance for us to do for others what we want them to do for ourselves. Otherwise, this virus continues to run rampant. And the other thing I really am focused on right now with this virus and the pandemic is the importance of being really good stewards of information and being very engaged in understanding what's happening around us and being able to make really informed choices.
Excellent. Dr. Roberts.
Yeah, thank you. And thanks for having me. And I'm delighted to join on the brilliant Black women panel. Definitely an honor. You shared a lot already, Tracy, about the disparities we've seen and why there's so much hesitancy from the African American community about this vaccine or about medical care in general. And I would just add that when you discussed about the vaccine rollout, clearly there is more demand for the vaccine right now than there is supply. And one of the things that I have been working on and advocating on behalf of the residents of Columbus and Worthington and really all of Ohio is that the vaccine distribution plan has not been created equally and has not been created to make sure the vaccine is provided equitably throughout our community. Just to put that in perspective for you, as you know, the first group to get the vaccine was group 1A, was primarily healthcare workers or those living in long-term care facilities. We know that there's a disconnect between the number of individuals who work in healthcare. We're not well represented. Black and brown individuals are not well represented in healthcare. And then when we had the age-based distribution, I can tell you that in Franklin County, 92% of African Americans are under the age of 65. So if we're trying to vaccinate our Black and brown community and we're making it age-based with a cutoff of 65 and older, we're missing a large percentage of our Black community. And if you look at our Latino community, 96% of the Latino community is under 65. So we have to remind those who are making the decisions that they need to think about that type of data when making decisions of who will be next.
Excellent, excellent points. So let's roll this back a little bit and talk a little bit about COVID, what COVID is, how it impacts us. So back to you, Dr. Warapa. Can you just share a little bit with us about how this COVID virus has impacts our body, how we attempt to respond to it, and what the fallout from this has been?
If that's okay with you, Tracy, would you like me to share a screen right now or no?
Sure, you can, absolutely.
Some slides or... Okay. I wasn't sure if we should go, Dr. Roberts was going to do that first, but in a nutshell, this virus has really taken a toll on us. And the beautiful thing to remember, I'm just trying to make sure I get my screen shared here. Can you see that?
Yes, we do.
Okay, great. All righty, perfect. what I think is really helpful, at least for me to understand, is I think of this virus really invader. If you think of invaders in your home, if you think of someone trying to enter your space, this virus is similar in nature. It's really trying to enter our body and our cells. And so the body's done a really great job in terms of the immune system of really protecting us by creating an army and an armor against any invader, any threat, in this case, the novel. It's worth noting that this virus has been around since before Christ. To be quite frank, it's been around since the early 3200 BC. And of course, in the last 17 years, we've seen it present as SARS-1 or COVID-1 in the Asian population. And again, it's resurged here and since 2019. But the army that we have in our body, it starts from our skin, from our nasal hairs, goes all the way through to our white blood cells, and they're protective. That's the army that we have been created with. It gives us everything from B cells and T cells. You've probably heard them referred to as antibodies or against invaders, natural killer T cells, and cytokines, which really, if you think of it as the body's nuclear weapon of getting rid of an invader, it does everything from gives you a fever, it can give you anything to really take that threat out. So the body's very well equipped to do that. I think of sometimes of Pac-Man, the game, when people go around and play Pac-Man, they would see it gobbling up the foreign invader. I think of the body as in some ways getting rid of a threat. The novel coronavirus is that it's a targeted approach to really trying to protect ourselves against an invader. And I know Dr. Roberts is going to speak a little bit more about the actual vaccine, but in a nutshell, you should understand that this virus, once it does enter the body, is very well equipped to do damage. And so our goal is to stop it from entering cells by any means necessary, and also to stop it from entering the body. And the vaccine, as a result, targets specific parts of that virus so that it can't latch on or attach to our cells. And as a result, it doesn't cause invasion and cause illness. The beautiful thing also about the vaccine is that it does prevent severe illness and death, which at the end of the day, those are the objectives we really want to have when we're trying to counteract an invader. I'm going to let Dr. Roberts interject, if that's okay with you. Let's see here. At any time. The one thing I did want to mention is that the virus, when it does invade a cell, can replicate and mutate. And we've heard lots in the media about mutations or variants of the virus. And so one thing that's worth noting with this particular virus is that it has already mutated in a couple of different countries. It's now mutated while here in the United States. And so the vaccines that we're using and we're hoping to get to be used by everybody are another way of defending ourselves against these mutations. Why? Because as the body's immune system builds up and the virus is not able to enter cells and replicate, it really doesn't have fertile ground for it to thrive in the community. And as a result, we can really hopefully get rid of this threat in the community. So I'm hoping that as we discuss further on today, people will see the value of using a vaccine. Vaccines have been around for a long period of time, and hopefully we can use them once again to take out a threat. Let's see here. Tracy, tell me if you'd like me to continue or if you'd like Dr. Roberts to jump in.
If there's more that you'd like to share, please, we have time.
Because I really want people to understand that if you think of yourself as just putting on your full armor, we're at war. It's that simple. We're at war. So you want to be very well equipped when you go into war. You want to have all your battalion gear on. And a part of that is, of course, your 3-layer mask and all the other things that you are being told to do in the community. And that vaccine really does provide somewhat of a shield so that that invading threat cannot enter your cells. Knowledge is also a part of your armor. So the more you learn about what's going on and about this vaccine in particular, the more equipped you are to go into battle. So I'm hoping that people really step back and recognize that if one person has a vaccine or an immunization against a threat, that's good for that one person, but that one person also interacts with everybody else in the community. And you can tell from this picture, the more people have armor on, the more we protect the entire troop or the entire group. And I think of that when I think of this virus and this pandemic, because each person absolutely can make a difference in preventing the spread of this disease and also in saving lives, because we touch people, whether it's your head of household and you have to take care of your family, whether you work with other people, whether you go to school with other people, no matter what you're doing, you interact with other people. So when you make a decision, you're making it not just for your own self, but also how it affects the we or the community at large. I will briefly just remind us that I know that we still have fears about the vaccine, and even seeing what's happening in front of us, we see people getting sick. We know that most people who get sick look like us, and still we're fearful of the vaccine. So I thought it would be very helpful to approach this decision making with not just facts, which Dr. Roberts will also provide some more in later on, but a little bit of faith and definitely what I call more of a scientific method approach to deciding how to best approach things. I wanted to share very quickly with people that when you're making decisions, your brain is very focused on protecting you, and it uses all the past experiences you've had, anything that you've seen in your lifetime, to really help frame its sense of reality. But be clear, the brain creates your reality. I use the example all the time of, if you're outside and you hear a bark, you think it's a dog, you assume it's a dog, but it's not until you actually experience that four-legged creature with hair approaching you that you can say, yep, this looks and sounds like a dog, it must be a dog. In the same way, our body and our brain is processing the things we're seeing around us, the history that we've had as a community and our life experiences. So as you're making decisions, I encourage you to not just rely solely on your past emotions, your past experiences and emotions, but also take a moment, pause, and really focus on what's happening in front of you now and dissect that truth. At the end of the day, no matter what's going on in our past lives, in our history, we can look and see, oh, well, people have gotten vaccines, no one's got a third eye, or they've lost a limb, no one's died from it. So we have to really integrate that reality with what we have in our history. I think of it as the scientific method. And basically the scientific method is you ask the question, you create a hypothesis. In this case, we're saying we don't think the vaccine's safe, it might cause harm. And then we test. We test to see if what we see and hear is true, whether we do experiments on our own or use the information from others. And then we make an assessment of that data, and then we make a decision. It wouldn't be COSI if we weren't using the scientific method, truthfully. And just so you know, we've already heard about the historical background about vaccines and the legacy that healthcare has had in this country for people of color. But know that the very smallpox vaccine, I think of that one as a really great example, relied on people having the courage to say, you know what, there's got to be a better way than letting this disease run its course. And we lost a lot of lives to smallpox until that vaccine was introduced in the early 1900s. We've had multiple opportunities to test and experiment to see if this vaccine is helpful. Experiments have been done by very credible researchers all over the world. We have multiple sources of information, and they've assessed both the design, the accuracy, the reliability, and really if all relevant variables have been assessed when doing their studies about the vaccine and its trials. We have multiple agents looking out for the quality of the studies that have been done, everyone from the Dr. Roberts of the world to the National Medical Association, which is an organization for physicians of color, the World Health Organization, which is run by Dr. Tedros. He's actually from Ethiopia, the CDC. There are lots of agencies and people constantly reevaluating this data to see if it's accurate, correct, and reliable. The vaccine that we currently have, Moderna, along with Pfizer, they've been studied for over 17 years. And in fact, Dr. Kissy Corbett, a woman of color at the National Institute of Health, was our lead in designing the Moderna vaccine. We are grateful to over 7,000 African Americans who volunteered to be in those clinical trials. And that was a pretty large sample size, a decent sample size. And now we have the observations. It's almost been a year since we've had those studies. The data, I'll wrap up and just let you know the data's been pretty clear, and I'm going to let Dr. Roberts go over that with everybody. And then at the end, we have to make the decision for ourselves. Do we have enough information to make an informed
assessment of whether or not this vaccine's good for us.
Excellent. Thank you so much for that, Dr. Warapa. Dr. Roberts, could you please just give us some opening remarks?
Sure. So, you know, I know there's a lot of questions and concerns out there about the vaccines and about the process in which the vaccines were created. And you heard a little bit about the way vaccines work from Dr. Warapa. What you hopefully will leave with today when you're done with listening and participating in this session is understanding how we got to where we are today with the vaccine development. And I know the name Operation Warp Speed turns many people off, and they think that this was the military and it's too much research based and it's not science based, and previous administrations were behind this and they don't trust that administration and they don't trust something that was made under the name of Operation Warp Speed. But I'm going to share with you some information where you'll see that there were no shortcuts made and safety was never compromised to get this vaccine on the market and to get this in the arms of United States residents and really residents around the nation to help slow down and stop the spread of this virus and to get us to the other side of this pandemic.
Sorry about that. Let's talk a little bit about that. Dr. Roberts, I've heard you speak quite a bit about the vaccine and its composition, et cetera. Can you share a little bit about what's in the vaccine and if there are any, because there's a lot of concern about that. Oh, it's a live virus and all kinds of speculation about what's in it. Can you share a bit about what's in it and if there have been any significant side effects or adverse effects?
Sure. So what's in it? It's a liquid, so it's made up of some sugars, some proteins, some fat, but it does not have the live virus. The live virus, COVID-19 virus, is not in the vaccine. The COVID-19 vaccine will not give you COVID-19. The vaccine does not have any meat or pork products in it. It was not made from eggs. That's part of the reason why it was able to get created so quickly. One of many reasons is usually vaccines are made from an egg base. And so you have to wait when it's egg based for things to cure and to culture in the egg base. But because it was not made in an egg base, it was able to be created a lot faster. It does not have any human remains in it, no fetal parts. Excuse me. And so I want people to feel reassured in knowing that. But it is made of some sugars, some proteins, some lipids, but nothing, no live virus whatsoever. In terms of side effects and adverse effects, so I think it's important that people really make the distinction between a side effect of a vaccine, which is something we anticipate happening, versus an adverse event. So side effects of the vaccines that are common in a lot of different vaccines. The most common is a sore arm, potentially at the injection site or even the whole arm. That's very common. People have that with the flu vaccine. They have it with the shingles vaccine. That's not unusual. Another side effect of this vaccine has been fatigue, particularly after the second dose, some body aches and pains. Again, these usually occur after the second dose, and that's not unusual. People have had that with the flu vaccine as well. Some people have a headache after this vaccine. Some people have fevers or chills. Those are side effects. That's what was seen in the clinical trials. Individuals who had those side effects still got a robust response, sometimes even a better response when they had those side effects. Now, what are some adverse events? The adverse events are things that we don't anticipate seeing after a vaccine. So those events can be everything from people have anaphylactic reaction. They break out in hives right after. They start having trouble breathing. They start getting nauseous and vomiting. They could even have a stroke. Those are adverse events. And those adverse events, once they're known by a vaccine provider or any healthcare provider, they are reported to the CDC in a system called VAERS. And VAERS stands for Vaccine Adverse Event Reporting System. And everyone who is aware of an adverse event from any vaccine is obligated to report it to the CDC so that CDC can keep a running list of adverse events that occur. Again, this is with any vaccine, not just with the COVID-19 vaccine. So those are some of the adverse events that we've seen or heard of, but side effects are normal. We anticipate those.
Excellent. So as we're rolling out the vaccine here, there's a priority of how the distribution is happening, from seniors to healthcare providers, and teachers are now in the loop, et cetera. Is there anyone who shouldn't get the vaccine? And how do you consider it if you have had COVID before? If you've had COVID, there's conversation about antibodies. Are you already immune and protected? Or if you've had COVID, should you still get the vaccine?
Yeah, all great questions. So the only individuals who should not get the COVID-19 vaccine are individuals who've had a severe adverse event from a COVID-19 shot. So if you had the first shot and you had a severe response, then you should not get the second shot. And then individuals who are allergic to any of the ingredients of the vaccine, particularly polysorbate, if they're allergic to that, they should not get the vaccine. And individuals would know that if they're allergic to that. Other than that, the vaccine at this point, the two that we have on the market are recommended for anyone and everyone who's either 16 years of age or older or 18 years of age or older, depending on what vaccine you're looking at. And then your next question was, I should have written it down.
Sorry. I asked is there anyone who, if you've had COVID, should you get
yeah. So if you've had COVID-19, the natural disease, you have some immunity. We're not quite certain how long that immunity lasts, but we believe that the immunity from the vaccine itself is much stronger and longer lasting than the immunity you get from the natural infection. Therefore, if you have had COVID-19, yes, you should get the COVID-19 vaccine. The recommendation is, as long as you're no longer having a fever and you're no longer in isolation and you can be out and about, then you can get the COVID-19 vaccine. That usually is about 10 days after the onset of your symptoms, okay? So you can get the COVID-19 vaccine. The only caveat to that is if you had COVID-19 and you receive monoclonal antibodies by your healthcare provider. Now, if you receive monoclonal antibodies, you would know it because you would have gone to a healthcare provider, you would have been monitored for several hours, and you would have gotten an infusion and an IV. That's a treatment we've been using here in Ohio since about December. And so if you had that treatment for COVID-19, you have to wait 90 days after that infusion before you can get the COVID-19 vaccine. That's the only caveat for people who've had COVID-19. So if you've had the monoclonal antibodies, you wait 90 days until after that infusion. If you had the natural disease and didn't have monoclonal antibodies, you need to wait 10 days from the onset of your symptoms, assuming you're fever-free.
Awesome. Dr. Warapa, we're talking about rolling out the vaccine here and who shouldn't get it, et cetera. But as we're waiting in line, because I'm still waiting, my age group hasn't come up. I've not yet qualified under any other circumstances yet here. So what do you, as a family medicine doctor, advise people to do in the interim while we wait? Of course, we've been observing the protocols of wearing the mask, social distancing, washing our hands, all of those kinds of protocols. But what else can we do to protect ourselves?
Well, you asked a great question, Tracy, and I look at it in two categories. What can I do to protect myself, the host, and what can I do to protect my community? To protect myself, yes, we wait for the vaccine, but fortify or optimize your own immune system. 70%, almost 70% of the immune cells in your body are in your gut. So what you actually eat makes a difference in how much your immune system can really handle a threat. So we are aware that processed foods and high fructose corn syrup, sugars, those things can actually stifle the immune system. So we really want to make sure we eat well or eat close to the ground or eat a more plant-based approach to our diet whenever possible. The other thing we can do is follow the basics. We are very aware that wearing a 3-layer mask and wearing it properly, that is, so not under the nose, but above the nose, over the mouth with a good fit, that absolutely reduces the risk of particles being exchanged from self to other people. And as a result, it also protects you from receiving particles. So wearing that 3-layer mask properly, and of course, keeping a good distance from people. Viruses, they're airborne. These particular viruses are airborne. So if you're in close contact with someone, it's likely that they will transmit it through airborne particles. So keep that 6-foot distance whenever humanly possible. And the last thing I tell people to do is ventilate their spaces really well. Open your windows. Don't stay in enclosed areas where there's not good air turnover. And that's a tough thing to do, which is why we're really working out some of the issues at the community level with people being in closed spaces, classrooms, office buildings, restaurants and pubs and things like that. So that's what we can do for ourselves. And when we do that, we actually protect everyone else in the community because we're lowering the likelihood that that virus will be able to replicate inside our own bodies.
You mentioned the mask, and I think that's really become an important part of the conversation because so many people are producing masks now. So my concern is, one of my contractors came in the other day and she had on the cutest little mask. And I said, how many layers is that? And she says, well, I think it's just one, but it has a filter in it. So, this is a whole new thing as this becomes part of our daily wardrobe. And, we're looking to make it fashionable and match our outfits and all kinds of things and use it to express ourselves with messages across the front of it. What do we really be considering when we're buying a mask? I mean, obviously, when we're using a medical mask, we're assuming that that's okay, that's sufficient layers. But should it have a filter? And, at first it was about the N95, I believe, but then we were saying, no, leave that for the medical professionals. So what do we need to look at when we're looking at this mask that we still have to wear?
I think people, if they have internet access, there's a great resource with the CDC that provides a really great list of the types of fabrics that can be used to make homemade masks and the types of things you should look for when purchasing a mask if you choose to purchase it. A 3-layer mask with a natural fiber like cotton is one that I typically use if I can't access a hospital grade a surgical mask. And there's wonderful research actually that shows that they're equally as effective when worn properly. So it does make a difference if you wear them properly and you wear one that has the right materials in it. Masks that have filters the filters are acting both as a second layer in some respects and also doing that actual filtration. So again, I would go and refer to the CDC link, and I'm happy to provide that link to the COSI team at the end of this so that people can go and look for themselves to see if their mask measures up, basically.
Excellent, thank you. That's really valuable information to have. Dr. Roberts, I want to jump back to the vaccine for a moment, and I know you're so intimately involved in the day-to-day of the distribution of this, but one of the challenges that I'm seeing that we're having now is finding out how do you access it? Even when it's your turn and it's your group, where you're getting information. My husband brought home 3 phone numbers the other day of places you can call to get an appointment, et cetera. And I've had a couple of people call me, what really is the best resource to find out, to confirm that it is your turn, and to find out how and where you make an appointment, because, knowing that you should get the vaccine and, getting on board with that, then it seems the next challenge has become getting that appointment to get the vaccine.
Yeah, and I share some of the frustration with community members about that, how to find out where you can get the vaccine. So first, I would say if you go to vaccine.coronavirus.ohio.gov, you can find information about who's eligible for the vaccine, and then you can find all the sites, the vaccine providers in Ohio, and you can narrow it down by county. The challenging part, like you described the scenario with your husband, is there's no one single number. If you want to get the vaccine from Columbus Public Health, you call this number. If you want to get the vaccine from Franklin County Public Health, you call this number. If you want to get it from Kroger, you call this number or go to this website. There's no centralized location. And I've expressed my frustration with that to the governor. The challenge is now we're in the midst of it. So to try to get everyone to use the same phone number or use the same system at this point in time will be a challenge because everyone has their own system set up that works with their electronic health record and they're all connected. So I think something that we I would encourage you to go to the state's website. I would encourage you to go to Columbus Public Health's website, which is columbus.gov/coronavirus. You can call our call center. We're open 6 days a week, Monday through Saturday, 614-645-1519. So those are available resources as well for you. Follow different providers on social media, listen to the news, go to their websites. Everyone will be posting information on their website. And if you live in Columbus or Worthington and you want updated information about vaccine availability and you have a cell phone and you text, I would encourage you to text us a message. The message should say VAX, V-A-X, CBUS, C-B-U-S, to the phone number 888-777. And as we open up vaccine clinics, we will be sending out text messages and alerting you to those available spots.
Wonderful. So it sounds like we're getting this, learning to manage this logistically a little bit better. The governor, as you mentioned, was on television the other day, and he mentioned a new opportunity through a partnership with Accenture. And is that the effort to actually kind of localize and get everyone going to one centralized point, or should people still continue to use whatever points of access they have?
Well, that system isn't up yet, that the governor referenced. And so until that becomes available, we definitely need to continue to use the various different websites that we know about and the various phone numbers. Where the challenge with that program, as I said, is, we're almost 3 months into this vaccine process now. So most providers like Columbus Public Health have already spent money and time creating their own platform that communicates with their electronic health record. And so for Columbus Public Health, it's going to be a heavy lift and a challenge for us to try to pivot and now work with Accenture for this. So we're looking into this on a regular basis, but it's hard.
Thank you for that. I'm going to turn to some questions that we received ahead of time.
And if I may interject, Tracy,
please.
I just wanted to add, for those who don't have internet access and it can seem overwhelming, I think Dr. Roberts would agree, they can at least start by dialing 211, which is our area, our Franklin County area go-to number for getting information, and they can connect you with a lot of the resources that Dr. Roberts already mentioned, or provide those telephone numbers directly.
Excellent. So everyone remember 211, and also check the COSI website, because I'm sure they are capturing these, and we'll post them, as well as our Columbus Public Health Department would be an ongoing resource for sure. So some of our listeners submitted some questions ahead of time when they actually registered to participate with us here today. So I'm going to turn to some of those in our last few minutes here. One of the questions is, after you get the vaccine, do you still have to maintain those protocols of mask wearing, et cetera, once you've had your first and your second shot and you have been immunized? Are you still required to wear the mask, and does it matter if you socially distance?
So I'll take a stab at that first. So yes, you're still expected to follow all the public health guidance that we've been saying for several months now. And that's until we start to see the virus activity come to almost zero in our community. So masks will be with us for a while, so you can continue to stock up on them and find the fancy ones you like so you can double up, but they're going to be with us. Now, socially distancing and avoiding large crowds, I think you're going to start to see some relaxation of some of those restrictions, but we're not going to go back to normal. I shouldn't say normal. We're not going to go back to pre-COVID anytime soon. I think we've got several more months before we're going to see any location, at least in Ohio, at 100% capacity. So 6 feet of spacing, avoiding those large crowds, wearing that mask is still going to be part of our daily uniform for some time. So the vaccine is done to prevent you from dying from the virus or from being hospitalized from the virus. So we have to remember that's the purpose of these vaccines. It's really to prevent severe illness. Will they prevent some spread of the virus? Yes. Will they prevent you from having symptoms of the virus? Yes. But the main purpose of these vaccines were to prevent death and hospitalization.
Gotcha. So who of the people who have not been vaccinated yet, when will we start considering that? For example, there's still the question around pregnant women, and now we have teachers that are in the loop getting the vaccine, but when will children receive the vaccine, or will they not? Either of you, please.
Sure. With respect to children under the age of 16, the studies are in process. So we don't have that information as of now with respect to children under the age of 16. The Moderna Pfizer study and actually the others were all done for people over the age of 16, and they are currently being done. The data on that is still pending, and as soon as it's available, I expect in the late fall, they'll be able to make a recommendation at that time.
Any
Yeah,
project? I'm sorry, please,
I
Dr.
just to piggyback on that, you know, the pregnant women, there are pregnant women who've gotten the vaccine. There were some who got pregnant during the clinical trials that they had for the vaccine, and their outcome was favorable. It is not unusual that we don't enroll pregnant women in clinical trials. So I think that's a personal decision between a woman and her doctor if she wants to get the vaccine while she's pregnant or breastfeeding. And as Dr. Rawapa said, with the pediatric vaccine, those are ongoing. We're optimistic that by the end of this year, there will be some vaccine approval for the older pediatric population, like 12 to 16. And then we're hoping in early 2022, we'll see some of the younger pediatric population be included.
Great. So you shared that obviously the mask wearing is going to be with us for quite some time here now. When do we anticipate that, you know, especially with some hiccups in the beginning of the distribution of the vaccine, when can we anticipate that we will be at that threshold for herd immunity? Is that going to be this year? Is it possibly going to be by this summer? Any projections on that yet?
You know, I don't think anyone knows the exact answer to that. You know, you've heard some of the national scientists say we need somewhere between 70 to 80% of the population to get vaccinated before we'll reach herd immunity. But really, the way we're going to reach herd immunity is to see what the virus activity is like. You know, at this point in Franklin County, we're getting about 200 cases of COVID-19 per day. So, and we still have a positivity rate that's somewhere between 6 and 7%. We want to get to a point where we're seeing more like 5 to 15 cases of the virus a day, and our positivity rate is below 1%. That's when we would have reached this herd immunity, and we can consider taking off our mask and loosening even more of the restrictions. So we've got a ways to go.
Okay.
Yeah.
Well, of course, we're all getting a little bit anxious. Dr. Rawapa, were you going to weigh in on that?
Nope, she said it best. I'll let it roll.
Okay. So I'm going to just to ask you, we're kind of coming to the bounds of our time here. Anything that I've not asked you that you wanted to share today or reiterate as a reminder for our listeners here today?
I'll let my Dr. Roberts close out, but I just want to share two things. One, with respect to fears and the anxiety sometimes that can come with that, be clear in the accuracy of the information. It may come from a known source, a familiar source to you, but that doesn't make it true. A partial truth is not actual truth. And a good example is actually, even with the Tuskegee study, for example, many people believe that men of color were injected with syphilis. And actually, in fact, it's just that treatment was withheld from them. So there was a known cure for syphilis, and it was withheld so that they could sit and watch and observe what would happen to them over time. That in itself is egregious, but we want to make sure we understand that nothing was actually given to them to make them sick. And the beautiful thing with this vaccine is that everyone's getting the vaccine, and we have wonderful data just from our own observations with our own eyes that people who are getting it, we're doing quite well. We're almost a year out, and still people are doing really well with it. So I encourage people to process information with as much clarity as they can, and not to take the easy option of relying on what we think we believe, what we've heard from others, but really do the work like you're doing today, asking the questions and testing to see if what you believe to be true is actually true.
Excellent. Dr. Roberts, I'm going to ask you to close us out. And one of the things that I would love for you to speak to, if you could, would be if there's going to be a requirement for this to be an annual process, the vaccine to be an annual vaccine, like with the flu shot, or, you know, would you get a booster? If you have any information about that, and whatever else you'd like to share, please.
Sure. Well, I will answer that first so I won't forget. We're not quite certain. We don't know the answer to that. We don't know how long the immunity will last from the first, or actually first 2 injections. And so there is a possibility that you will need this annually, and time will tell. We're going to learn that together. So we will see what happens with those who were involved in the clinical trials. And if we learn that their immunity wanes after a year or 18 months, then we will realize that a booster is needed. So we'll also see how long this virus survives in our community, or really across the world, if this is something we're going to continue to need, like the flu vaccine that has been distributed for so many years. So we'll have to wait and see. I saw a question in the chat, and I just want to make sure I address it. You know, right now we have 2 vaccines on the market. Both of them are 2-dose vaccines, and they're effective. Again, they're effective at reducing the mortality from the virus and reducing the severe morbidity, meaning hospitalization. This 3rd vaccine that we hear the FDA might give emergency use authorization before the end of this weekend will be a game changer. It's 1 dose. It is also very effective. The one thing I want to remind people is this vaccine, the Johnson & Johnson vaccine, the clinical trials were done in South Africa and in South America while these new variants were circulating. So the fact that it has such a great effectiveness, despite the fact that it was being tried while we had these variants, is a very good sign. And so some people often say, well, I get a choice when I go somewhere of what vaccine I can get. Most of the time you will not get a choice. The right vaccine for you is the vaccine that's available. All of these vaccines are going to be effective at reducing mortality and severe morbidity. And so that will be the right vaccine for you.
Wonderful. Well, thank you both, Drs. Roberts and Dr. Warapa. We really appreciate you being with us to share your information and knowledge and educate us on this. Excellent information, very valuable. We just ask our audience to please keep listening, keep learning, paying attention, check your sources, make sure that you're getting accurate information, and make sure that you at least consider getting your vaccine. Really important for you, your family, and for all of us. I'm going to turn it back over to Vanessa right now. The one question that I saw in the chat that I didn't, or that was submitted to us, we had a couple of questions about COSI and when it will be opened again. Lots of people are interested in engaging, so I'm going to ask you to check the website, check COSI's website, because they do have postings there. And also remember to dial 211 for information, check with the Columbus Public Health Department so that you can find out when it's your turn, where to go to get your vaccination and get your appointment. Thank you so much for joining us. Thank you again to COSI for hosting and having us today, and all of our partners who supported us. Vanessa, back to you.
Thank you so much, Moderator Hurd. And thank you all so much for sharing your time and talents with us today. It was so refreshing to hear all of this important and valuable information. And I know as I can speak on behalf of all of COSI when I say we're so honored to host the 4 of you today. So thank you. I wanted to close out the program and invite the founder of the Color of Science program to join us to give closing remarks. He is such a strong advocate for science literacy within our community, and he even just launched his very own primetime TV show all about science called QED with Dr. B on WOSU. So please join me in welcoming COSI's President and CEO, Dr. Frederick Bertley.
Thank you very much, Vanessa. Great job facilitating this. I really want to stress, we brought this program for all of you as a community. One thing that COSI is passionate about is that we take partnerships seriously. And you can see the partnership with MAC, with, of course, the City of Columbus, and Dr. Roberts and Dr. Rapa, really bringing you this expertise to share and address as many questions that you may have around what's been consuming us the most in the last year, and that's this pandemic, and most importantly, how we get out of it. So I really want to thank all of you guests, starting with Dr. Rapa and Dr. Roberts, our experts. The fabulous job by Ms. Tracy Maxwell Hurd facilitating this conversation. I appreciate the opening remarks by Demetrius Neely from the King Arts Complex. This is a COSI Connects Live Color of Science combination with the Heart of Protest, really bringing to you another signature program to help elevate our community to make sure we can be the best we can be. Finally, I'd like to give a shout out to Kevin Lau from Columbus Black and the Alpha Kappa Psi group for supporting this program. Ladies and gentlemen, this is another COSI Connects Live Color Science event. And to the audience member who wants to know when we open, like Dr. Roberts says, we're going to open as soon as possible based on how much more this virus level comes down and the availability of vaccines. We're already safe inside. In fact, I'm in my office at COSI. We want to make sure that the community feels as safe as they can be. So with that, thank you for joining in on another great program. You guys are our #1 fans. We appreciate you. We can't survive without the great interest that you all have on the nation's #1 science museum here by USA Today, and that's COSI. With that, have a great afternoon, everyone, and please join us on March 4th, which is next Thursday, for another fabulous COSI Connects Live Color of Science program. We will have an interview with none other than Ms. Kelly Girardi, who is an amazing, incredible engineer in astrophysics and aerospace, and is the best person who can tell you how you, as a regular individual like me and you, can go up into space one day soon. Stay tuned. That's next Thursday, March 4th at 12 p.m. noon. Have a great day, everybody, and have a lovely weekend.